We are the first in Minnesota in our second year. Sold out today at 410 tickets, and again, feedback appreciated as we look forward to next year. There will be another event coming up on July 20th. This is in White Bear Lake, Minnesota. It's an ADAPT event. Dr. Westman will be there, Dr. Sean O'Mara, Dr. Tim Noonan, Kate Newman, who's here today, Dr. Paul Ratti, and Maria Emmerich. So a great contingent of kind of mostly Minnesota or Midwestern low-carb experts. You can Google ADAPT Minnesota July 20th. So, all right, fantastic. Let's start with some questions here. All right. So for Amy, fairly simple. What is the name of your book again? How can people...
I meant to say this when I was up there. My book is called The Alzheimer's Antidote. You can find it on Amazon. I have 3 copies available. If you would like to purchase one, I can sign it. See me afterward, but I just have 3 that are, hopefully, get them while they're hot. The Alzheimer's Antidote.
Excellent. And for Jenny, can you recommend a good book for keto beginners?
I think that might depend on what kind of a person you are. I'm going to recommend Keto Living Day by Day, a book by Christy Sullivan, who really holds your hand, explains everything, has motivational sayings, and lots of good recipes for everyday food, plus some desserts and things like that. But, if you're not really interested in that much detail, I think Dr. Westman has a pamphlet that page 4 I've heard is amazing. It's like all on one page what you need to know. So depending on what you're looking for, I would say those are sort of 2 great options.
Excellent, thank you. And to Adele, is there any alternative to the epidemiological studies in health research that you discussed today?
No, there's not, in terms of figuring out what prevents chronic disease. Well, there's not a good alternative because a randomized controlled trial that's going to give you significant information about the prevention of chronic disease has to have hard endpoints and mortality, morbidity endpoints, not just biomarker endpoints. Has to go for a number of years, 8, 12, 15 maybe, has to have a diverse population. So randomized controlled trials are great. If we can, I don't think it's unethical to do them. Like I think it was mentioned, keto versus a carbohydrate diet, but it's going to be hard to have one that goes out long enough that's going to give you hard endpoints. I think what we have to understand is that dietary guidelines are based on nutrition epidemiology of chronic disease. And nutrition epidemiology of chronic disease is based on the dietary guidelines. They go together like this. If we got rid of one, the other would go away really quickly. And if we got rid of the other, the same thing. So dietary guidelines rely on nutrition epidemiology of chronic disease to provide bad information on which to base dietary guidelines. Nutrition epidemiology of chronic disease relies on the dietary guidelines to promote ineffective, weak science and put it into policy. So unfortunately, what you really should be doing is consulting with your personal healthcare provider, a doctor, a dietitian that you trust, and find out what you can do to prevent the diseases that are prominent in your personal, family, and health history.
For Dr. Westman, can you please clarify the bottom line of one of your slides talking about limiting cheese and dairy? If keto is high fat, moderate protein, low carb, can you please speak to this?
Great, thanks. Yes, you can have cheese. Remember, I grew up in Wisconsin. Sorry, I didn't want to declare until, the true believers were still here. I grew up in Madison, Wisconsin, actually. We went from mother's milk to beer and cheese. Probably similar in Minnesota. But so page 4, you can find it if you just need a handout of lists. What I do is I say state of the food on page 4. In other words, if it's not on here, you can't have it. just to be a very strict low carb list of foods. But the high calorie items, the cheese, cream, and mayonnaise on the expanded version have 4 ounces of cheese, 2 tablespoons of oils, 2 tablespoons of mayonnaise, and it's a kind of a generic, here's how you can get going with a limit on the high calorie items for most people that'll work really well. And what happens after the first day or two is you're just not hungry anyway. I mean, it's almost like you have to get through the, okay, I'll just get started. And then after day 2, people go, oh, gosh, I'm not even hungry. And I, just tactfully don't remind them that I told them that, I mean, but I also got a question about total versus net carbs. And if you've heard of total versus net carbs, we use total carbs. The method I use goes back 150 years before net carbs was even talked about. Net carbs came around about the year 2000. We use the net carbs in the New Atkins book to make it look more nutritionally consistent with the guidelines. But classically, doctors who use this, Dr. Atkins, Dr. Eads, Dr. Bernstein, they all use total carbs, because when you use net carbs, you get into this, how do I calculate the fiber subtraction, and can I have those bars that say 2 net carbs on the front, and yet it's 20 total carbs, and they make me hungry, and it's fake food. So really, total carbs is a little stronger, it's a little simpler, and then you don't eat all these fake foods that are out there. Although, yes, the ADAPT bars are 2 total grams, so they are consistent with the total carb method.
Another one for you here, Dr. Weissman. Does eating a diet high in saturated fat contribute to plaque buildup in arteries? And if so, is that something to worry about?
Yeah, no, fat in the food doesn't lead to the arterial fat. And that's a big area of confusion. I mean, it's not so long ago, I remember doctors on TV, fat in the food, fat in the arteries. Are you stupid? It's the same thing. It's the fat in, right? I mean, okay, you're supposed to laugh because it's not. I mean, so the fat in the food, fat in the liver, are you kidding? No, and that's the connection, actually. Yeah, foie gras, which is a delicacy you feed geese sugar or starch or corn, more specifically, and they develop fatty liver, and you eat the fatty liver. It's called foie gras. I mean, if you're a French, connoisseur. So it's actually the fat in the liver that leads to the VLDLs and the small LDLs, and actually it's the carbs that lead to the fat on your arteries. But it's so hard to explain that. And it's so hard it's almost like I'm saying there's no God and we're in a church, because it's a belief system, and so it took writing Cholesterol Clarity with Jimmy Moore to really, in that book, he just took the information that researchers were talking about cholesterol and arterial health. It's inflammation that sets the stage for the cholesterol to be a problem in the first place. So what you want to do is eat a diet that's low in inflammation. It doesn't cause inflammation, and actually saturated fat doesn't cause inflammation. But I know it goes against everything we've been taught. And it's actually the sugar and the starches that are contributing to the fat in the liver, and it's the fat in the liver that's contributing to the fat and the VLDLs that lead to the small LDLs that lead to if you want the cholesterol story, it's not the fat in the food.
For Jenny here, how can we feel successful if we fail once? For example, enjoying ice cream with children. Does this a no-fail lifestyle change?
Well, I think we addressed this a bit in our second talk, but I think there are many, many people who can enjoy the benefits of a low-carb or ketogenic diet and can go off-plan. You know, it varies how often, but sure, I think having an ice cream with your children, sure, but maybe not every day, right? So, like, birthday cake is okay unless you live in an office where someone's having a birthday every day, right? So now, as Adele mentioned, there are people who can't cheat. They need to be super strict or they'll lose so much ground with their blood sugar that they'll experience terrible outcomes the next day, So I think it depends on you, but if you're not trying to keep type 2 diabetes at bay, I think definitely some cheating can work. It might make you a little hungrier. You might want to keep cheating, but as long as you resolve to get back on that horse, if you're relatively metabolically healthy, I think that can work for a lot of people. And maybe one of our nutrition experts could talk a little bit more.
It's not cheating, right? Because who are you cheating, right? When I worked with Dr. Westman in the clinic, and this question would come up, I talked to patients, and I said, just think about carbohydrates the same way that you think about alcohol. There are people who can't or don't drink alcohol, either for health reasons or because they know that addiction runs in their family, or because they simply choose not to. You could be one of those people. There are people who drink alcohol or eat carbohydrates on special occasions as a way of celebrating. And I'm actually one of these people. You're going to feel lousy the next day, but you make that choice. If I eat too many carbohydrates or if I drink too many margaritas, I'm going to feel lousy the next day. And so I don't do it very often because it's not cheating. I pay for it. So it's, you can't call it cheating because there's a cost. But very few of us can eat whatever we want, drink whenever we want, and as much as we want without some consequences. So you just have to think about what your own limits are and then choose wisely.
Adele, right back at you for another one. Is a vegetarian low-carb diet possible? If so, what protein or fat sources do you recommend?
This was also something that I did in Dr. Westman's clinic, and it's a vegetarian low-carb diet is very possible. A vegan low-carb or ketogenic diet is far more difficult. So there are many delicious vegetarian foods, cheese, milk, eggs. You don't have to eat animal flesh. And those are all excellent. I mean, eggs are a terrific source of protein. And if you get them from your friendly neighborhood farm or from chickens you have in your backyard, then you know that they're being humanely raised. So you can feel good about that. And the chickens don't care. I mean, they don't. So, and the same thing with dairy products. Those are excellent sources of protein. Full-fat yogurt is an excellent source of protein. If you can, so it's soy. If you tolerate it, if you don't have any issues with it, a lot of people do have soy sensitivities, but soy is a good source of protein. Tofu and tempeh are low carb. So a vegetarian low carb diet is very possible and also can be really delicious.
Amy, can you speak to fish oil or omega-3 supplements in terms of potential for reducing risk of cognitive decline or Alzheimer's?
Sure. So I mentioned that the brain, those cell membranes, especially in the neurons, are really, really rich in omega-3s, especially DHA. I think the question had something about prevention, right? In there, can just taking fish oil or eating fatty fish prevent dementia? By itself, probably not. You absolutely do need those fats to have healthy neuronal, communication, but I don't think they're necessarily a preventive measure. Like, for example, if somebody has insulin resistance or type 2 diabetes or metabolic syndrome and they're experiencing cognitive decline, if they make no change to their diet, all they do is take fish oil, I would not expect much of a change, if any. But as part of an overall, nutritious, brain-supporting, lowish carb diet, it's probably really helpful, but I don't think by itself it's going to do a whole lot.
And for Dr. Westman, can you speak to the time frame of eating meals. I think what they're getting at here is maybe time restricted eating or eating in shorter windows and what value that might have.
Yeah, my training is that there's a lot of flexibility in that regard, that there are a lot of different styles of people and one size doesn't fit all. So if you're eating in a healthy, nutritious way and you are hungry just once a day, that's fine. In fact, a lot of people say, well, I don't eat after 8 p.m. because I know that's better. I said, well, who says that? You know, I think you can even eat right before you go to bed. If you're not eating carbohydrates, you don't get the insulin effect, and it's called the sumo wrestler effect because they eat copious amounts of food and then go to sleep, so that every little bit of food goes right to their body, the sumo effect. So, but you're not eating food that raises the sugar that raises the insulin. So it doesn't really matter to me when people eat. A lot of people are using time-delimited eating as a behavioral tool to eat less throughout the day. I think it's fabulous if you're not hungry. I'm not a fan of powering through hunger just because you're intermittent fasting. If you're hungry, eat even just a little bit, and then that usually fades away over time. I think over a keto-adapted period, those who do this for years and years, you end up eating once or twice a day, and I think that's just natural. Having gone to a meeting in South Africa with Professor Timothy Noakes, who flipped from you have to carb load to do exercise to no, don't eat carbs and you'll even do better when you exercise. He had a conference. I met some people who were the world's experts in lions and behaviors, and they eat once a week. And then and when lions are hungry, they go out and hunt. They don't always eat. Think about that when you think you have to eat 5 times a day because you don't have any energy on your body. You know, anyway, so I think there's a lot of flexibility. And who says that you have to eat 3 meals a day with 2 snacks anyway? Oh, those diabetic people.
Silly dietitians.
Another one for Dr. Westerman: is a keto diet safe for pregnancy?
Well, you know, do you have to eat sugar, Doc? No, right? You don't have to eat sugar, and starches get digested to sugar. So if you're just eating healthy foods and you call it keto and you have a baby, is that unsafe? I'm just flipping it upside down. Okay, so yeah, we're worried about it because it's something different than what is known, and then once you get into pregnancy and people lose their brains and then also sue doctors for anything that goes bad. So what we want is data of people who are doing it, and kind of like this phenomenon that's happening, people fixing their own problems. I know a lot of women who are already just doing it on their own. And in Indonesia, in their Facebook group, we want to do a survey because they said we have 30 or 40 keto babies. We call them keto babies. Mom was keto, the baby's keto. They seem to develop even faster than the traditional milestones. And so, but in the U.S., I can't say that it's safe.
This is kind of open here, but sugar alcohols and diet sodas or artificial sugars. Maybe either Jenny or Dell, do you want to comment on these in terms of their place or maybe lack thereof in this lifestyle? Jenny?
Well, I think that, again, this depends on you and your experience. I think there's a bunch of information. I see a lot of news articles about people finding that artificial sweeteners in sodas and whatnot are causing similar cravings for sugar. So obviously that would be a little disruptive to add that to your life. But I just have to tell you, if you have to have that gin and tonic diet tonic is a much better choice, right? And if you are addicted to a Coke for lunch, a Diet Coke, it may not be ideal, but I don't think there's any evidence that, any hard evidence that that's going to derail everyone. The sugar alcohols they don't really agree with me personally. I don't know if you've tried them. I find they upset my stomach. But are they healthier than Splenda? Well, it seems like the world thinks so, but sometimes I wonder. I don't know.
Yeah, we have kind of, again, a flexible way of teaching. Anything but sugar as a sweetener can be used, and people still lose weight. There's endless debate about whether it's harmful to have those things. I don't see it as a big risk. No, people aren't dropping dead, and I know that's not reassuring. But again, it's kind of a transition. If I didn't have artificial or non-sugar sweeteners, I couldn't get people off sugar. So it's like you can look at like methadone or Suboxone maintenance to get people off of heroin. You'd rather have them not use the thing to get off of heroin, but at least they're not using heroin. Diet doctor Andreas Eenfeldt, good friend of mine, he looks down from Sweden because they're in the north, so they look down. Oh, but we might be at the same latitude. But he looks down because he's 6'7". Thank you, you saved me. And he goes, "Why do you eat that crap, Eric? Why do you have that artificial sweeteners?" I said, "Well, we have a sweet tooth thing here in the U.S. that you don't have in Sweden. I mean, so is there any health benefit from having a Coke Zero or a Pepsi One? No, I don't know of any benefit other than it keeps you away from sugar. And then whether you need it, it's an individual thing. I'm reminded of the first time I met Dr. Atkins. That was in that photo back from 1998. I said, "What do you do?" And Dr. Atkins said, "Well, I need these bars. I need the artificial sweeteners because I get a craving." And Jackie Eberstein at the other end of the table said, "No bars, no artificial sweeteners. You cut it all out because eventually you're going to go back to wanting sugar." So I thought about that a lot, and there are different types of people. Some people can have some sugar and even artificial sweeteners, and others can't. So I tell people to try it out and see how it works rather than, "Oh, I can't do keto because I can't have artificial sweeteners." That doesn't seem right to me.
We'll try to do about one more per person here and wrap up. Dr. Westman, again, I have metabolic syndrome, but my doctor won't test my insulin level. Is this necessary? Do I need it? And if so, what other testing do you recommend before changing to this way of eating?
Well, part of my training was in the VA Veterans Affairs system, where we learned that if you weren't going to change what you do, you wouldn't really do much testing. It was kind of a stewardship of, if you had very little resources, what do you really absolutely have to measure? So if you know you have metabolic syndrome, meaning you have the abdominal circumference is large, you're overweight, you have high triglyceride, low HDL, you have an abnormal blood glucose, and elevated blood pressure, but maybe not diagnoses of diabetes or hypertension, there's really not any other measurement you need. If you're going to choose to treat it with a keto diet. So you have to understand my practice, and maybe yours too, an obesity medicine practice. And I met another doctor here. Can you stand up? Is it Dr. Gustafson? Are you still here? Anyway, he's in the back there. Thank you. So in an obesity medicine practice, you're up north of here. Yeah. I know I'm going to put someone on the keto diet, so I don't test insulin levels. Now, if you're in a family medicine practice and you're trying to persuade someone to change, there's a role for that. So you might get, if you're saying, "Oh, I don't know that it's a problem for me yet," and you would be persuaded, if my insulin was high, well, then I would do it, then get the insulin level. But I don't see that it's going to change what I do because I know it's going to get better. because I have that confidence from the research that the insulin level will get better with the successful diet.
To Jenny here, I eat a bowl of oatmeal every morning. Is this a habit to break? I like it because it's filling and easy, and I don't have very many carbs throughout the rest of the day. Is this okay?
I would put that in the class of kind of those careful carbs we talked about on our plate, even though it's obviously a grain. But if you are feeling good in the morning, you're not getting hungry 3 hours later for lunch, and you don't have metabolic issues, then maybe that's just fine for you. I have seen people, again, with this CGM technology, tracking their blood sugar with oatmeal and being shocked by how much their blood sugar goes up, even with unsweetened oatmeal. So if you're really curious, you could simulate a CGM by just buying a cheap blood sugar meter at your local pharmacy and just stick your finger every 10 minutes, starting about 20 minutes after you ate that bowl, and just sort of see what happens. But, you know, I think, again, it all comes down to your individual response to that bowl of oatmeal.
To Amy, with insulin being associated with so many diseases and carbs raising insulin levels, is there any need to eat carbs? Does our brain need carbs?
I was hoping we would get to this question. So I think I'm going to boil that question down to, are carbs necessary at all? Do we need to eat carbs? And frankly, the answer is no. You can if you want to. If you enjoy carbs, if you're happy with your metabolic health, with your weight, with your cognitive function, with how you just feel in your own body, eat carbs. Do you have to eat them? No. Is your brain going to melt and fall out of your eyeballs if you don't eat bread? No. We have essential amino acids from protein, and we have essential fatty acids from fats. There are no essential carbohydrates. Thanks to this wonderful little process that everyone in keto is so terrified of, called gluconeogenesis, which literally translates to the making of new glucose, we can make carbohydrates in-house. Our own bodies make the carbohydrate that we need. So there seems to be some requirement for glucose in the brain. For glucose, not for carbohydrate. Just because the brain and just because certain other cells, certain other processes in the body require glucose doesn't mean we have to ingest bagels and frosted flakes to get it. We can make it. Now, there are some cases. I've actually had a couple of clients who I advise to eat more carbs. Like I said in my talk, not everybody needs a super strict ketogenic diet. Many of us do, but some people can eat more carbs. Do you have to eat carbs if you don't want to? No.
And I think we'll do the last question here. Adele, this is for you. Your thesis and presentation today showed us that our government and the guidelines really aren't where they should be. I think this is sort of my question, actually. But, today's events demonstrate just the power of sort of grassroots interest and change in helping to make this way of eating happen. Is there hope? Are we going to see in our lifetimes this be more accepted and, an option for everyone who needs it?
There absolutely is hope. When I started working with Eric Westman in 2006, I think Dr. Atkins had just passed away at that point. 2003. And the low-carb world was sort of in its little factions. We were getting a lot of bad press. The second wave of low-carb was sort of coming through, and there were a lot of low-carb products, and then the products went out of favor, and they got a lot of bad press as well. Nothing quite as bad as keto crotch, but in that time, in the time that, sadly, it took me to go to graduate school and graduate, the tide has turned. So there's a number of really hopeful things. Now, if you are out there holding your breath for the dietary guidelines to change, go ahead and breathe now. Because the dietary guidelines are going to change last. So this is our history. Low-fat eating had already taken over America before the dietary guidelines were put into policy. It was already part of our cultural makeup before it became the dietary guidelines officially in 1980. And this is what's going to happen with low-carb diets. The word keto may go away. Something else may take its place. It's going to be the same thing. Carbohydrate restriction for reasons that have to do with health and feeling better in your body. And it may be fatty liver disease. It may be chronic yeast infections. It may be Alzheimer's. I mean, we don't even know yet what the studies are going to bring us. But if in that short amount of time, and really it is a short amount of time, I just got through grad school, right? If we've gone from the American Diabetes Association saying that a low-carb diet is not only ineffective, it's dangerous, to, as Jenny pointed out, a low-carb diet is one of the safe options that we can offer to patients with type 2 diabetes, and that lowering the dietary carbohydrate in any dietary pattern is the most effective intervention for lowering glycemia in people with type 2 diabetes. We have come a long way, baby, but we're just getting started. And it is places like this, and it's groups like this, I said before, it is going to be a grassroots movement, but we're going to take over the world. And why are we going to do that? Not because this diet is the best diet ever and everybody needs to be on it, but because there are a lot of people out there who need help. And we have that help to offer. And that's what's going to change things.
All right. Well, thanks to our presenters again, all of whom came via Brainerd or MSP to Brainerd on flights from the East Coast, traveling long distances to be here for us today. For all of you who hung around and were here with us all day, thank you for your patience, especially through some of our sound and technical issues. And again, your feedback's appreciated. Keep eating the butter. We'll see you next year.
Hey, I just want to say a special thank you to the local area medical professionals who helped put this together for our speakers, and especially Dr. Jeremiah here. He really did a lot of work this year. Wouldn't have been possible without him. For our sound guys, for Dwayne on the video, a lot of people came together for this community event. So God bless.